Medical practitioners in Lagos State have linked the current outbreak of cholera to poor environmental conditions. According to the Nigerian Center for Disease Control and Prevention, the outbreak has hit 32 states with over 1,500 cases and 51 deaths recorded. Now, Victoria Tokolo spoke with medical professionals and residents in Lagos on the current outbreak. Take a look.
The root cause of the cholera outbreak in Lagos State has been connected to environmental pollution and food safety issues. According to available data, there are 876 cases of cholera in Nigerian's economic capital. The Lagos University Teaching Hospital has treated 5 cases, with 4 patients discharged and 1 fatality. As a referral facility, LUTH handles critical cholera patients such as those with kidney failure. Speaking with medical practitioners at LUTH in Idi-Araba, Dr. Ayodeji Oluwole, the chairman of the Medical Advisory Committee, and Dr. Adefolarin Opawoye, the head of the Consultant Infection Diseases Department, stated the hospital's measures in curbing the spread of cholera among the staff.
In LUTH, we have a good sewage system. In fact, the federal government refurbished our sewage 2 years ago. We had to bury new pipes. So there is no contamination between our sewage disposal and our source of water. Because that's one of the greatest or easiest way to have contamination that can spread within a community.
By bacteria called Vibrio cholerae, gram-negative bacilli, and it's basically transmitted by eating contaminated food or water. You know, where there's an environment where people don't have the good drinking water, or there's contamination of water with feces or sewage, and then there could be cases of cholera that way, and that's what we are seeing now. And there's a lot of work going on to actually try to reverse the trend and to stop this particular outbreak.
Visiting 2 markets in the Mushin area of Lagos State, it's evidence that criticism of the government is discouraged. The conditions of the toilet and waste disposal areas are in a terrible state. The Iyaloja of Mushin Main Market, Kafayat Ajose, and Shabola Akogun of Idi-Araba Ojuwe Market spoke about their efforts to keep the markets clean and free from cholera. However, they refused to allow any filming of their toilets and waste disposal areas, saying it could lead to the shutdown of their operations due to violations.
Every cause is environmental. Our big waste product is on the road. Then the motor, every day, the motor will come and pick the waste product on this market. There is no cholera here.
There's no any marketer. Then this market, what you are doing up and down, to monitor the community there. They know that they cannot do whatever you like. Give them instruction.
Respondents in the state also complained about the dirtiness of the environment, stating that Lagos is not as clean as it claims to be. They pointed out waste management vehicles that has been lying with garbage on the street for more than 3 weeks, causing an unpleasant odor and inconvenience to residents.
The very present day that it happened, they came with a mechanic. They were trying to do it, maybe, I don't know, the following day also they came, even the 3rd day, but after then, I can't see them again. And I think they're supposed to have come and carry it because of dirtiness of the street and all these diseases, cholera and etc., etc.
Nigeria, Africa's most populous nation, is presently battling with the outbreak of cholera, a food and waterborne disease that is ravaging the country. The outbreak comes at a time when the price of sachet water, Nigeria's most common and cheapest source of safe drinking water, went out of the reach of the masses. Prices of sachet water recently hit the rooftop, with retailers selling a bag for between 300 naira and 400 naira, and 1 or 2 sachets for 50 naira depending on the location and temperature of the water bag.